But before you seek this treatment for yourself, I'm speaking with Dr. Kelly Brogan this morning, author of A Mind of Your Own, to help get on the path to peace of mind without the use of drugs. Doctor, thank you so much for joining me this morning.
It's great to be here. Thanks, Heather.
Well, I definitely think this is a great topic today because there are so many misconceptions about depression in general, one being that it's simply a chemical imbalance. So will you kind of clear that up for us? Tell us what depression really is.
Absolutely. So we're told a story about depression, right? It's probably something you're born with. It's going to be something you have to deal with for the rest of your life. And because it's a chemical imbalance, you have to manage it with other chemicals, with medications. And, you know, my experience is that not only through my clinical practice over the past almost decade, but through a deep dive into the literature, I have learned that actually what we are calling depression is not a single entity. It's not a disease. It's not a clinical picture, you know, the way that we're told it is. And what it is instead is really a symptom, often, of chronic inflammation, right? So in this way, it's no different than any of the other conditions of modern civilization, whether it's heart disease or diabetes or autoimmunity or even cancer, where the way that we are living, the stress we're exposed to, the chemicals we're exposed to, the diets that we're eating, the water that we're drinking are impacting our immune systems in such a way that we're developing symptoms. And the trouble with depression is it's not diagnosed through a blood test or a brain scan or EEG. It's really just a conversation with your doctor. So if you don't know what to look for in terms of reversible drivers of depression, then you could end up, you know, far down a path that you might regret.
Well, right, and to hear just how many people, especially women, are being medicated for depression, I mean, is it safe to say that a lot of these have been misdiagnosed?
You know, that's my opinion, is that if you don't know what questions to ask, then you might end up, you know, never having the opportunity to reverse a lot of the symptoms that we're calling depression. So 1 in 4 women of reproductive age are taking an antidepressant. This is incredibly common. And, you know, you don't want to be taking an antidepressant for your thyroid condition, right? Or for blood sugar imbalance, or for a specific food intolerance, or for the side effects of a common medication, whether it's birth control or acid blocking medications. It wouldn't make sense to take an antidepressant. And in that way, it's almost like taking Tylenol for a piece of glass in your foot, right? It might help somewhat, but it's not actually getting at the root of what's driving it.
Well, and doctor, in your book, you actually talk about, you know, if you don't want to take antidepressants, you want a healthy, natural way to kind of combat these symptoms that people are having. Can you give us a few little tips from your book?
Yes. So, you know, the protocol that's outlined in the book is really for anyone who's taking an antidepressant already and is still symptomatic, who's considering taking one in the future, or who is interested in, you know, coming off of one that they've been on for some time, that maybe they're just interested in a new approach to their health. The protocol is really the same, and it's centered around raising the resiliency of your body, right? So optimizing your physical health so that we can really see what are the symptoms that you're dealing with psychiatrically, because they may actually resolve in the space of a month of lifestyle change. And so, you know, the pillar of this approach is dietary, because even though I only had 1 hour of nutrition education in my conventional training, the truth is that food is information. It speaks to your genes, and it can alter the way that you feel and reverse the possibility of chronic disease, you know, even within the space of a month, which is really, you know, quite miraculous in my opinion. So food is the primary pillar. This isn't a 30-day juice fast or anything like that. It's actually, you know, a diet that tastes good, should be filling, and should really liberate you from a lot of the addictive foods that, you know, sort of yo-yo us around our life, you know, on a day-to-day basis. And then there are some other practices that you can engage: 3 minutes of breathing a day, 20 minutes of exercise a week, and then detoxification of your environment, which of course is a lifelong process. But I give you the initial tools to consider, you know, to begin to bring this, you know, in this type of healing into your arena.
Well, doctor, this is definitely going to be a great tool for anybody who feels like they're suffering from depression or even knows somebody who is. So tell us, where can we get more information and a copy of your book?
Yes, so the book is available everywhere, including on Amazon and in Barnes & Noble and local retailers. The first chapter is actually available on my website, which is kellybroganmd.com, and there I also have tools about how to speak to, you know, anyone that you might know or love who's struggling with this.
Well, this is great, doctor. I want to thank you so much for taking the time to speak with us this morning.
Thank you so much.
Now, don't go anywhere. The Morning Blend will be back after this.